Hi, welcome. This is the Minority Health Report with Dr. O. I'm glad you found us. I decided to start this YouTube channel to focus on issues that affect minority healthcare. There's a lot of talk about inequities in healthcare and how it affects a minority population. I hope that this channel will be a source of solutions to some of those problems. Okay, a lot of the data and statistics I'll be quoting here comes from the 2018 North Carolina Health Equity Report. And I would like to delve into that a little bit because these are some things we already knew existed, but I don't know how the information is being boiled down to the population that it actually affects, where we can use it properly. So I decided to start this YouTube channel to help us address those issues. A little bit of a background about me. I have been in private practice for about the last 19 years in Charlotte, North Carolina. My clientele is typically the urban population. Being an immigrant, I have a lot of immigrants that come to me, be they African immigrants, Hispanic immigrants, African Americans, and so on and so forth. So the issues I will discuss on this channel are near and dear to my heart. Some of the other reasons include the fact that there's a lot of misconceptions in our communities regarding what is real and what is not. And with the proliferation of media, social media, people can come in and spout falsehoods with nobody checking them. And with those falsehoods become accepted as facts. And a lot of times in my practice, patients come in and say, well, I did my research. We get a lot of those, and even within the doctor community, we start making a joke about it. I did my research, a 5-minute research on Google to arrive at conclusions. Be that as it may, social media and the internet age is helpful because there's a lot of information out there. However, I hope this channel would help us drill down to the real information, to the real data, to understand what's helping and what's not helping us. Okay, a couple of terms to define here before we get going. Health inequities. There's a lot of talk about this. There's a lot of definitions out there. Health inequities basically refer to all those things, socio-economic and cultural things that make healthcare access not equitable for all. What does that mean? For instance, where you were born, what zip code you live in, and those kinds of things. How you interpret health information. What are the unfair advantages that we face in the minority community that mitigates against our getting the care that we need? Health disparity. What does health disparity mean? Well, we all know the data as well. If you are African American, if you are Hispanic, and you went to the hospital for, say, a heart attack or stroke, your outcome will be different than if you are a white patient, a Caucasian patient. If you're an African American male in North Carolina, your chances of dying from prostate cancer is 2.8 times greater than if you are a white male. Say that again. 2.8 times greater of dying from prostate cancer than if you were a white male. Infant death mortality, or infant mortality rate, also called infant death rate. Overall, the infant mortality rate in North Carolina is about 7.2%. When you break it down, Caucasians have about 5.4% death rate, infant death rate. In African American women, guess what? It is 13%. In Hispanics, it's 5.1%. So we live in the same state. We have babies. If you're an African American woman, you have a 13% chance that your child will die. If you're a Hispanic woman, you have a 5.1% chance that your child will die. If you are a white woman, the chances are 5.4% that your child will die before age 1. Why are there these differences in death rate, in mortality rate in infants? That's what health disparities addresses. What are the things that make these things happen that way. These are not just numbers, these are real lives that are lost due to disparities. Let's take another example. Chronic diseases, heart disease, stroke, cancer, kidney problems, diabetes. These are things that are predominant, particularly in the African American community, particularly in the Hispanic community. But again, if you look at death rates and rates of complications, you have much higher rates of these in the minority populations than you have in the Caucasian population, in the non-minority population. These are some of the things we will discuss and tackle with this channel. We're not just going to come here and spew numbers that eventually, with our eyes glaze over, nobody wants to pay attention. We're going to drill down into what's causing these disparities and how do we address these disparities. Other things that we'll talk about: social determinants of health. Social determinants of health. Dr. O, what does that mean? Well, if you were born in Charlotte, North Carolina, if you are born and raised in a certain zip code, your outcomes in healthcare is so very different than a different zip code. Why is that so? Why does that happen that way? Right? Social determinants of health: your level of education, your income stability, those things matter a whole lot. I'll give you an example. A lot of times my patients get lost to follow up. They don't show up for not 1 year from their last appointment. And then we find out that they lost their job, therefore they lost their insurance. And because they lost their insurance, they stop taking their diabetes medicine, they stop taking their blood pressure medicine. And they come to me a year later, 6 months later, blood pressure is through the roof, diabetes is through the roof. All of a sudden, they have already developed kidney complications. These are all the things that affect our health, social determinants of health. How do we mitigate against those? What are some reasonable solutions we can come up with to help address these issues? These are important topics we will be discussing on this channel. The format of the channel is going to be like this. Sometimes it will be me talking directly into the camera. Sometimes I will have invited guests come help me break down some of these challenges that we have. I hope you tune in. It's going to be an interesting ride. I've been doing this now for so long. I decided it was time to project beyond just the bedside, right? I can do so much good by my patient's bedside one-on-one, but an avenue like this would help me project louder to my community that I serve. Please tune in, come back, visit us regularly, subscribe if you like us, tell people about us, give us ideas what things to discuss on this channel. All is welcome. Okay, thank you for joining in. We're hoping that this will be a very productive time for all of us. All right, God bless.